more insight on how China is providing for its rapidly aging population. Let's turn now to Xi Chen. He's an associate professor of health policy and economics at the Yale School of Public Health. Great to see you, Professor.
Glad to join you, Elaine.
Well, we just heard about this new app to help senior citizens in China. Of course, there's always a learning curve, teaching seniors how to use a new app or some sort of new program. How can technology, though, help this large aging population? We're seeing apps. There's a lot of discussion about AI. How can this help this population as well as its caregivers?
Yeah, this is a great question. As population aging, we have more and more older persons, and they require assistance in daily life. And originally, there was some digital divide that separating the less tech-savvy old adults from their those young people. But with more availability of new technology like automation, like robots, and all this AI assisted living, so there are more user-friendly tools for the older adults to use. So that's a very important development for them to access. And in China, that we know that most of older adults are still living in the communities. So it's important to make sure those technology can reach those individuals. Unlike in many Western countries, people more live in the assisted living facilities or nursing homes. So make those technology available to each individual home is even more challenging.
We know that China has the world's largest elderly demographic. What are some of the other ways their needs are being addressed by the government? We know that this has been an issue for many years that they've really been working on.
Yeah, indeed. So starting from 2018, many Chinese cities start to implement something or roll out something called the long-term health insurance, which partially pay the family members and the professionals to take care of older adults. And some of them lose much of the functional abilities. They have to move to nursing homes. And the long-term care insurance also pay for that. And we know that this is getting more and more challenging as we live longer. People are all having some kind of chronic conditions or functional limitations. Earlier this year, I led a World Bank report about 30 countries. We published, it's online now, and it shows that no matter whether it's developing countries or developed countries, about 20% of the individuals never receive any care. That range from taking a bath, shopping, managing financial wealth. So some of them are even more challenging because they need those services on an hour basis. Some are less challenging because they may manage this on a weekly basis, like financial management. But still, this is getting more challenging, no matter we're talking about Western countries or developing countries like China. And beyond that, there are even more recent development in the financial sector.
Professor, we have about 30 seconds left, but I quickly want to ask you about this private pension program that the Chinese government recently introduced because of this pension gap. Just quickly your reaction, and if you can, share with us what is the largest expense for senior citizens? Is it medical care? Is it the long-term care?
Yes, that's a great development in the last couple of days. Actually, in China, about 2 years ago, China started to roll out private pensions in some cities. This is now reaching most of the Chinese cities and covering more and more older adults. And we know that to have a more functioning, well-balanced aging financial system for older adults, we have to have 3 pillars, which include the public pension, the employer-sponsored pension, and the private pension. Most of the pensions so far in China concentrate on the first pillar, which is Social Security. But with population aging, we need to develop more and more the second pillar, which is sponsored by the employers, and the third pillar provided by the private insurance. So that's a lot of room to develop in this area.
Professor Xi Chen, thank you so much for joining us from the Yale School of Public Health. Always great to see you.